Hi you guys, welcome back to my channel, and today I'm basically going to teach you how to be successful in Med Surg, y'all. Oh, and Chanel's going to help me. But y'all, when people hear Med Surg, I don't know what it is about Med Surg. They automatically panic. They automatically get afraid. But I got y'all. I got y'all. Okay? I'm going to show y'all how I went from struggling first semester to making A's and B's in my Med Surg classes. I'm basically going to tell y'all what I did differently to basically bomb and just kill Med Surg, okay? So if you pay attention to this video, you're going to do fine. Take a deep breath. If I can do it, anybody can do it, okay? The first thing that I did, and it's going to sound so silly, I gave in and I decided to be nice and get me a study partner. When I tell you first semester I studied by myself, I never studied with anybody until second semester. So I got me a study partner. And I'm the type of person, I truly believe that you should only have one reliable person. Maybe two, but I feel like 3, 4, 5, that's a party. I don't think that it will be productive with that many people studying in a group. So I found me one study partner and we basically helped each other. Y'all, this is the semester that you're gonna feel like you're not gonna be able to get through it. You're gonna need the motivation, you're gonna need the strength, you're gonna need somebody to help you and to encourage you to get through it. So I highly encourage you. If you're that person who like to do everything by yourself, I highly encourage you to find you a study partner. Okay? The next thing I highly encourage you to do is manage your time. Y'all, this semester is going to feel like it's not enough hours in a day, because not only are you going to have crucial tests and crucial assignments, the clinicals, y'all. These patients on these floors, I worked as a med surg floor for 3 months. I'm sorry, y'all. My mind is all over the place right now, but I worked as a med surg nurse for 3 months. And when I tell y'all, those patients are sick. Like, med surg is not a joke. Not only is the class hard, but the clinical is going to be hard. So I encourage you guys to manage your time, get you a planner, and be organized, okay? So it's the first day of school, T. What should I do on the first day? And I encourage this on the first day. First day, you should be reading. Read everything. If your teacher tells you, okay, chapter 13, 14, 15, 16, 17, 18 is on the test, I want you to read every last one of those chapters and every last one of those pages. That's what I did differently. I felt like with fundamentals, I just basically skimmed everything. I didn't therapeutically read the chapters. This semester I encourage you to read everything. I don't know about y'all school, but where I went to, shout out to Southern University, my professors provided me a cross sheet. And the cross sheet basically outlined everything that is going to be on the test. And when I tell you I followed those cross sheets, if she said pages, chapter 12 pages, 8 through 10, I strictly read 8 through 10 and I highlighted everything. So what me and my study partner would do, we would basically go to class, we would record our teachers. Some people might not let you record them, but y'all, if they let y'all record them because they know what's on that test. They know the material that is going to be on that exam. And I promise you, if it's on that exam, it's going to be mentioned in class. So what we would do, we would record our teachers that allowed us to record them. We would go home on our own and we would read everything. Do not go to a study group if you haven't read the chapter. That defeats the purpose. It's basically like, okay, I'm here, teach me. No. Go on your own, read, highlight, and gain some knowledge before you meet up with your study partner. So we would do that. Y'all, this is a side note, but this is very, 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 very important. Find you someone who graduated or someone that's ahead of you that have some notes, because I promise you that can save you time. When I tell you, I knew a guy who was ahead of me, and I told him, I was like, if you have anything that you would like to give to me, I would take it. When I tell you, Every semester he sent me his notes. So I will basically print his notes out. I'll bring them with me when I study with my partner. I will bring them with me when I went to class. Anything that was said that was not on his notes, or anything that was said that I read and had highlighted that he did not have, all I had to do was either retype it or just basically write it down on the side. Y'all, when I say you want to appreciate that, that saves you time. I honestly don't think that I would have survived Med Surg if it wasn't for his notes, or for my, like, for his notes, because I saved so much time not having to worry about writing my own notes. Because the fundamentals, I had to write my own notes. I had to read. It was a blessing. Those notes were a blessing. So I highly encourage you to, if someone offer you their notes, take them. So me and my study partner, and I also gave her the notes as well, we would write personal notes. We review the content together. Then, which is, this is next thing, this is also important, we would do questions together. So she will pull up her laptop, I'll pull up my laptop, and we'll basically pull up sources. I love what's the name of that website I always use? Nurses Lab. I love Nurses Lab. We'll pull up Nurses Lab together, and we'll pull up the same exact questions. She'll read it and answer it in her mind. I'll read it and answer it in my mind. And once we both think we have the answer, we'll discuss it. And just say, for instance, she got C, I got B, and I was wrong. She'll say, hey, T, it's B because of this, this, this. I get why you think that, but no, it's this way. And I think that was very, very helpful, because it helped me think, it helped me think about the nursing process. So do questions with your partners. Therapeutically discuss the questions and why this answer is right and why this is wrong. Because when you go to that test, when I tell you, I went to the test one time and I had a similar question. It was not the same as that question. But I remember what my study partner, Nisi, shout out to Nisi, girl, I love you. I remember what she said, and it was in my head. And I was like, oh, wait, I remember Nisi said it was this, this, this. And I got it right on the test. Y'all, also, I did not review my rationales first semester. Like, I used to just answer questions. When I got to Med Surg, I started to read every rationale. I encourage you to do tons of questions and read rationales, because I promise you, those rationales is going to be on the test. You might not get the same exact question, but you're going to get that same exact rationale. I promise you. You're going to see that rationale more than once. So get you a partner, do questions together, and therapeutically go through those rationales. Not only that, and this is going to sound silly, y'all, know y'all skills. I will never forget, I went to go review my test, and I had a question wrong. It was about a JP drain, y'all. I ain't never heard of JP drain in my life. And the first thing my professor said, well, if you looked on your cross sheet, the cross sheet said, look in your skill book and read pages 100 through 103. Not only on Med Surg will you get questions about like the diseases and symptoms, you're going to get questions on your skills. I'm going to give you an example, okay? So you have a patient with an ostomy. When should you change that ostomy bag? When it's 2/3 full, right? You have a patient with a trach. How deep should you suction that trach? Of course, it's not going to be this basic, but it's going to be something like this, okay? How deep should you suction that trach? How many seconds should you suction that trach? Okay? When I tell you, I had so many questions on my skills. I got to the point where if we were in clinicals or in the skills lab, and we were basically taught a skill, I mastered that skill because I knew that I was going to have a question or two on that skill. And not only do you need to know your skills, you need to know how to like critically think, y'all. Like I said, I worked as a Med Surg nurse for 3 months. Those patients are sick. Not only are they sick in the hospital, but they're sick on that paper, on that exam. Don't expect in fundamentals, you get the nursing process. You're going to get basic stuff in fundamentals. Med Surg, these are going to be the most sickest patients ever. And not only that, always expect the worst in med surg. Okay, you in a room and your patient chest tube just came apart. What you gonna do? All right. You in a room and the patient trach just came out. What are you gonna do? I had so many questions basically asking me what should I have at the bedside post-op. Like I remember a question I had. A patient had some type of jaw surgery and the patient mouth was wired shut. What should you have at the bedside 24/7? You're going to need scissors just in case something happened to the airway. You might need to cut that patient mouth open. Just always expect the worst to happen. Med surg is not glamorous. Even on the exams, those patients are not going to be glamorous. Always expect the most critical and the most horrible situations to happen on your med surg exam. Okay? Not only that, I want you guys to learn how to master select all that apply, because I'm sorry to tell you, it's not going, it ain't going nowhere. When I tell you, one time we had like 10 select all that apply questions on the test, and I wanted to just ask my professor, like, baby, who hurt you? Like, was this necessary? Like, literally went through the test, whole test was fine. Get to that last page, 10 select all questions. And I just had to look at her. I was just so disgusted. Like, really? Why would you do that? But master select all, because you're going to see tons of select all. And a lot of examples, I don't know about other schools, but my school love to put select alls as delegation questions. Okay, you're the RN. Which assignment, select all that apply? What could you delegate to the UAP? What can you delegate to the LPN? Y'all, know your delegation, okay? Not only for med surg, but for NCLEX. I'm telling you. Look at me. Know your delegation, okay? And also, for some reason, my school love to put select all that apply. Your patient is on a low sodium diet. Which food can I'm going to school to be a nurse, not a dietitian. Don't be asking me all about these diets. Like, come on. No. But for some reason, even on UWorld, when I was studying for NCLEX, I had so many questions asking me about these diets. Know your diets. Know what type of food they can eat. Because I promise you, you will have several select all that applies. Okay? Also, y'all, I already talked about delegation. Priority. I feel like most of my questions on Med Surg were priority questions. Not only do you need to know who is the highest priority, you got to know what is the least priority. And I'm going to give you an example. Okay, you just came onto your shift. You have 4 patients. Which patient you want to go see first? Are you going to see a patient who just had a heart attack and stable, or are you going to go see a patient who complained of a minor headache but now having some clear nasal drainage? Now, that might not sound important, but that is something new. That's who you want to go see. And when I tell you it be stuff like that, because you hear heart attack and you're like, oh, I'm going to go to the heart attack. But in reality, it's the person with the headache, because it's something new. And like I said, I'm going to do a whole separate video on basically how to teach y'all how to do priority and delegation questions. But I'm telling you, Med Surg, because as a Med Surg nurse, you're going to know, you got to learn how to prioritize. You're going to have tons of priority questions. And what I mean about knowing the least priority, I had several questions where some type of natural disaster, maybe a hurricane, tornado, something happened, and my charge nurse came to me and say, hey, we need to discharge patients. Which patient do you recommend to be discharged? So you need to determine who is the least priority, like who can go home first, who is the stable person, right? So that's what I mean about delegation, like not delegation, about priority, knowing the most important and knowing the least important, okay? If you listen to those tips, I promise you, you're going to do fine, y'all. Like I said, get you a partner, read everything, do questions. Don't sit there and just do questions just because, y'all. Get your rationale books, read the rationales. Take somebody notes that are already made to save you time on writing your own notes. Go through those notes, make corrections, record your teacher. Everything that she says, 9 times out of 10 is going to be on that test. Not only that, like I said, don't expect easy, simple questions in med surg. This is the semester where you got to apply your knowledge. Expect the worst. Prioritize and delegate. All right. Y'all are going to do well. I wish you guys a great semester, and I cannot wait to upload content for you guys. Thank you for watching my video. Don't forget to give this video a thumbs up and subscribe to my channel. See you guys next time.